This week, we're talking about healthcare inequality, but it's important to start with a conversation about how cultural considerations affect healthcare delivery. There are a lot of different kinds of patients, um, and there are many different kinds of diversity. A population can be diverse along all sorts of lines: race, gender, ethnicity, culture, age, nation of origin, language, religion, education, socioeconomic status, living conditions, even familiarity with the healthcare system. So, treating all patients as if they're the same, i.e., white middle class men, can lead to problems. Another thing to think about is that there are really cultural differences in the concepts of health and medicine. So, take, for example, something you do all the time. If a person sneezes, what do? You probably say, God bless you. And the reason you do that is because at one point, um, people who came here believed that when you sneezed, your soul could escape through your nose. Therefore, it was important to bless the person immediately, lest any nearby demons take over the vulnerable body. For most of us, saying bless you is now just a cultural ritual, a nicety, a show of politeness. We don't actually believe that demons may take over our bodies when we sneeze, or for that matter, that illness itself might be a sign of a problem with our souls or spirits. This is because most Western societies are dominated by the biomedical model of health. So, what do I mean by this? We tend to believe that illness and treatment should come from the Western scientific tradition, including ideas about germs, biochemistry, biophysics, etc. But this is really just one tradition of many. Throughout the world and in different communities in the US, other belief systems dominate. These are ethnomedical belief systems, and they're culturally unique beliefs and knowledge about health and disease. If you assume that everyone is operating under the Western biomedical model, you may have trouble treating them and getting them to agree to your prescribed treatments. There may also be philosophical differences between healthcare providers and their patients in terms of the attribution of illness or health. Many cultures attribute illness to spiritual forces. For instance, the Hmong view physical illness as manifestations of spiritual illnesses. And so the treatments aren't through doctors, but through shamans. There may also be differences in cultural approaches to death and dying. Um, as we've discussed, in the US, death is seldom spoken about, and both patients and physicians frequently resist those conversations. Other cultures accept death as part of life and may even have a fatalistic approach to disease. So that's something that you need to know when you go in and are working with patients. Part of that can also be religion. A patient's psychological state can significantly affect treatment. So, ignoring those belief systems can result in poorer outcomes for patients. Oftentimes, we think of these religious views as outside of the realm of medical practice and care. Once again, that biomedical model. But a patient's religious beliefs can play an important role in their health outcomes. Among other things, religions offer strong networks for people who are sick. And strong support networks have been linked to positive physical and psychological outcomes. Studies show that regular churchgoers are generally healthier, have a lesser risk of hospitalization, depression, and reduced mortality rates. So, knowing a patient's religious beliefs can help a doctor provide better medical care. Um, We also need to be aware of this because there may be cultural taboos against certain Western medical techniques, surgery, blood transfusions, transplants. And these are commonplace beliefs, but also commonplace medical techniques. And failure to recognize those aversions may lead to poor consequences for the patient and the provider and their relationship. Um, it's also important to know that even if patients are going along with Western medical practices, they may simultaneously be seeking treatments that are from their own cultures, from exorcisms to herbal remedies. And again, it's important when providing care to know those things. There may be interactions that we don't know. So, just thinking about that, these are important considerations. Different understandings of illness can often create miscommunication in the healthcare setting. So, medical practitioners might not even be aware of the perspectives and understandings that their patients bring into the room. And patients may themselves not know the ideas that their providers are bringing. So, Arthur Kleinman, a psychiatrist and medical anthropologist who's interested in cross cultural medicine, has suggested 8 questions that medical providers should ask their patients in order to gain a clearer understanding of each other and each's understanding of the medical condition that the patient is facing. Some of you may be familiar with these questions if you've read The Spirit Catches You and You Fall Down. So, what are these questions? First, the practitioner should ask, what do you call the problem? Because there may be cultural specific names for the disease in question. What do you think has caused the problem? Remember, step outside of your biomedical model. Why do you think it started when it did? Again, attribution. What do you think the sickness does, and how does it work? How severe is the sickness? Will it have a short or long course? If a patient thinks that taking a pill is going to solve the problem and it's going to go away, you take the pills for 7 days, but really what you're talking about is a chronic illness, we can have real miscommunication. What kind of treatment do you think the patient should receive? What are the most important results you hope the patient receives from this treatment? What are the chief problems the sickness has caused? And lastly, what do you fear most about the sickness? Again, these questions can lead to better medical outcomes. It's also important to think about challenges that are specific for immigrant communities that really are unique when they come to the US. First, we have to think about immigration status. For the undocumented or those living with family members who are undocumented, there may be a fear of exposure when seeking medical care. Additionally, immigration status can limit your access to care, especially given the way that healthcare in the US is tied to employer provided insurance or government programs. Both of those lead to immigrants, and particularly undocumented immigrants, being at a disadvantage. Another challenge that immigrant communities face is acculturation. These communities in particular may face greater health risks when coming to the US because they're faced with different lifestyles. One that's usually in the US more sedentary than the ones they're leaving behind. And the eating habits in the US are also much less healthy. American food is served in larger portions and is higher in sugar and fat. This leads these communities to greater health risks like heart disease and diabetes. But again, we can have an interaction where if they don't approach health in the same way as the Western model, they may not connect the change in lifestyle with the health outcomes, and so they might not know to change habits. Additionally, immigrant communities face many stressors um, that can come from dislocation and from their home culture. This leads to anxiety, stress, and depression. Those issues are compounded by the stress that racism creates, and that often has terrible health outcomes. So, these conditions in turn can lead to substance abuse, and providers who are unfamiliar with these stressors or the communities are they can not give culturally appropriate care or medical care. Um, the communities themselves may be unaware of the treatments available, and this leads to these communities being underserved by the medical system. There are additional challenges. Clearly, there are language barriers. Immigrant communities often face those when interacting with the medical establishment. It can be difficult to find practitioners who speak your language. And even when translators are available, complicated medical jargon can be difficult to understand in translation, and especially in the types of stressful situations you find yourself when you're getting these diagnoses. Another important thing to be aware of is the issue of informed consent. In addition to basic conceptions about health, different communities approach communication about health in different ways. In the West, we tend to have a legalistic tradition that's evolved. We stress the patient's right to know, and decisions are considered individual in nature. And privacy laws are designed to keep a provider from discussing health, the health of the patient with others. Now, in a collective society, however, this focus on the individual is really problematic. In patriarchal societies, the health decision really might not be in the hands of the young or of women. So, Western discomfort with these traditions doesn't change their importance to the patient and the patient's community. And if you don't address this, then you're going to have poorer outcomes uh, with these patients. Another thing to keep in mind is the preference for communication styles. Um, Western approaches believe in direct communication from doctors about illness. We prefer when physicians don't, beat around the bush, whereas other cultures do prefer more ambiguous or indirect communication about health, particularly in terms of terminal diagnoses. So we really have to be thinking about this. It's why culturally appropriate translators are so important. So that we need to make sure that all of the communication that is going on is not only put in language that people can understand, but in appropriate communication styles that allow patients to hear them and act upon them.